So imagine working 70 to 80 hours a week while carrying hundreds of thousands of dollars in student debt. That's the reality for resident doctors, physicians that are still in training. So Bernie Sanders, I came across this video where he recently met with 20 of them at the University of Chicago and Northwestern. When he asked about their schedules, they told him that they were working up to 80 hours a week. And Sanders called it exploitation, pointing out that overworked doctors aren't just at risk themselves, this can also impact patient safety. So his message was very clear, that the system needs reform to protect young physicians and the patients that they serve.
What is the life of an average resident? How many hours are you working? What about the stress that you're working on? Who wants to jump in on that?
I'm glad that they're having this conversation. This is not something that is talked about a lot. Residency means to reside. So you reside in the hospital. You spend a lot of time in the hospital. As an orthopedic surgery resident, we spent a lot of time in the hospital. I actually had a call room at the hospital that was right near the trauma bay, since we were so busy at a level 1 trauma center. I had a shower, I had a bed, I had a microwave, I had a fridge. And when I used to go to work, I would work sometimes 30 plus hours. And that came out to over 80 plus hours, 90, sometimes 100 hours a week, which is crazy.
I work about 70 hours a week.
70 hours?
Yeah. Our call shifts are 28 hours long.
I am a patient. Should I feel really good in getting treated by one of you who've been up for 24 hours?
Absolutely not. You should be worried. You should be concerned. There are restrictions and laws for pilots who fly a certain amount of time, or even drivers who drive 18-wheelers, drive trucks. There's restrictions in terms of how many hours that they can be awake and how many hours that they can work. I think the same thing should be applied to the medical field. The ACGME came out with guidelines in terms of how many hours physicians are able to work at a certain time. I think this was passed in 2003, where that hour per week it's about 80 hours per week, because this was fueled by some deaths from patients, from doctors that were tired, and which led to those deaths. So they came up with these hours. But is that really followed in today's residency fellowship programs? No. But it is something that places a limit in terms of how many hours physicians are supposed to be working. Not safe though.
You know, we handle every need from the patient, every page. You know, so it's not like the patients have a choice in like, oh, I want a fresh resident, you know, but ultimately I would want to concur with that. I'm a surgery resident and we definitely work 80 hours a week.
We're talking about working 70, 80?
No.
Most of you working that?
Yeah.
Yes.
And tell me about what that means to you physically and your feeling about how well you are doing your job, working 70, 80 hours.
Like, a lot of times when you've been up for 24 hours, you literally feel sick. Like you don't feel well.
Just want to kind of be very frank, direct. We ask the question of why doctors burn out, why doctors commit suicide. And to be totally honest, I have been burnt out almost since I started medicine. It's not only physical health, it's mental health. And the burden often gets put on us. Why don't you take?
She's absolutely right. The physician suicide rate is not talked about enough. Actually, 1 physician per day, that's kind of the average number of physicians that die every year. And out of any career field that's out there, physicians have the highest suicide rate. This can lead to mental health issues, depression, other thoughts of like burnout and those talks. She's absolutely right. Working this many hours can place a lot of undue stress on physicians, and it's something that is not talked about enough.
Take care of yourself. Why don't you exercise? Why don't you eat better? But when you're working 80 hours a week, you go home and you still don't know if your patients have good care because of the political environment that we're in. You go home with those patients still in your mind and in your heart, and I can't take care of myself when that's on my mind, and I don't have time to. So I just wanted to point that out as well, that it's overall just general health is like really suffering for us.
Yeah, I mean, this is something that absolutely needs to be discussed, needs to be talked about more. Physicians, our health, our well-being should be emphasized, and we can't take care of patients if we don't take care of ourselves. And it's hard to do that if we're working 80, 100 hours a week. So let me know what your thoughts are. Put them in the comments below. I would love to hear from you, and kudos to Bernie Sanders for just speaking up about this and raising awareness.